Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to talk with you for a few minutes about non-surgical treatments of Peyronie's disease. In this brief video, I'm going to define Peyronie's disease, discuss some of the common misconceptions associated with Peyronie's disease, and provide you with some examples of non-surgical treatment of this common condition. Peyronie's disease is defined as angulation or bending of the penis that results in pain during intercourse for the man and or his partner. It's a common condition, and most men after middle age have some element or component of Peyronie's disease. 10% of men after a surgical removal of their prostate gland for prostate cancer will have Peyronie's disease. Usually, this problem does not go away without treatment, and it usually worsens in half the men with the condition. It's a common cause of erectile dysfunction, and most men with erectile dysfunction have some element of Peyronie's disease. In the past, there have been oral therapies consisting of either vitamin E, pataba, colchicine, tamoxifen, and omega-3 fatty acids, but they produce no benefit compared to a placebo or sugar pill. Consequently, those oral therapies are not recommended for Peyronie's disease. Now, a drug that has been used for peripheral vascular disease to increase the blood supply to men who have decrease in blood supply to their lower extremities, called Trentol, has been reported to have 1/3 of the men have a positive response to this oral medication. Also, L-arginine and the phospho-5-diesterase inhibitors, Viagra, Levitra, or Cialis, increase the local levels of nitric oxide and can be associated with a decrease in the progression of the disease. There are topical treatments such as topical verapamil, but however, no independent studies confirm its efficacy. Shockwave that has been used for the destruction of kidney stones have been tried for the treatment of Peyronie's disease with a weekly shockwave treatment for 4 weeks. Studies have reported no improvement, and interestingly enough, some of the men who receive shockwave therapy have been made worse. There are injections, particularly injections of verapamil, that reduces the size and firmness of the plaque that is in the penis that is responsible for the curvature. To use verapamil, it requires an injection every 2 weeks for a total of 12 injections. Also, interferon injections have been reported to have a 25% improvement rate. Another injection is Clostridial collagenase, which has been used in the treatment of debutans contracture, which is a similar problem that occurs in the hand and has been reported to have mild improvement in Peyronie's disease. To use Clostridial collagenase consists of 2 injections per week for 60 weeks with the likelihood of a 30% improvement. Lately, there has been the advent of penile stretch therapy that has been proposed by Dr. Larry Levine from Chicago, Illinois. This is the application of a vacuum device placed over the penis twice a day for 12 days. Reports by Dr. Levine indicate that nearly 2/3 of the men had improvement in the curvature and also approximately a 1/2 inch in increase in length of the penis. Penile traction therapy, consisting of a device called fast size, which was invented by Dr. Larry Levine from Chicago, is worn on the penis that places an external traction on the penis. This device has to be worn for 2 to 8 hours per day for 8 months in order to achieve a improvement in the Peyronie's disease. The men who do this and are religious about performing the traction therapy report a decrease in curvature and an increase in length of the penis by approximately 1 inch. Also, these men have reported an improvement in their erectile dysfunction. Again, this technique or this treatment option, it may be helpful to the highly motivated man with Peyronie's disease who is willing to comply with the treatment program. In summary, Peyronie's disease is a common condition that significantly impacts millions of American men. There are non-surgical options, and I suggest you see your urologist. When these non-surgical options are not effective, I'd like to refer you to my website, www.neilbaum, or to YouTube, and if you type in Peyronie's disease surgical therapy, you can see the surgical options that are available. I hope you have found this information useful. If you have any additional questions, please do not hesitate to contact me at 504-891-8454. Thank you.